What's up, you guys? It's Steve and Liam. Happy Sunday. And we have got an update for you on stimulus and Bernie Sanders continuing to push to get more provisions out. Now, as you guys know, we're keeping you up to date on everything: stimulus checks, child tax credits, Social Security increases, and now he's also pushing for free medical for everybody in the nation. So he's still pushing for these stimulus provisions, which we've heard are going to be returning during midterm elections, as we're seeing it unfold exactly like we were told. Now, I've got some video footage for you. This is about a 16-minute long session where he is just discussing this in the Senate. So we're gonna cut right to it because this is a long one, but you're gonna wanna hear it as he breaks down a lot of this information, talks about corruption, talks about how people need this help. And it's a shame, I think he says like 87,000 people in the whole nation die every single year because they lack the proper medical care that they need. So we're going to take a look at that. Also wanted to mention very quickly for you guys that the relief roadmap, if you have an account created that you are in, I'm probably going to be locking it here, so that way roughly about like maybe the 5 or 10% of people that are having login issues, I can get them situated, I can control that, so that way there's not new accounts coming in. I'm going to block it just for a little bit. So if you are not a part of the relief roadmap, very soon it's going to be blocked, but you can get your email address on the wait list, and then once I got everyone that's in there taken care of, then I'll open up a new wave of people to start new accounts. So that way we can just kind of control things. So if you're in, you have access to the comprehensive list of every single stimulus check in the nation. We're going to be adding more programs, updating things, temporarily blocking accounts that are new from coming in. And we're going to get you guys taken care of. Then we'll open that up again. Also, wanted to mention the second channel. Expect more content. And with that being said, smash the like button if you appreciate the updates. Hit the subscribe. Smash the like button, hit the subscribe button to see more content. If you have any specific questions for me, shoot them to me in the DM on Instagram at SteveRam3. And with that being said, guys, let's go ahead and take a look at what Bernie Sanders has to say.
We are worried about climate change and what that is doing to our planet. We're worried about the terrible war in Ukraine and all of the destruction taking place there. We're worried about inflation and the fact that wages are not keeping up with the prices that people are paying. We're worried about the massive level of income and wealth inequality that exists in our country and the increased concentration of ownership that we see in the United States, among many, many other things that are on people's minds. But to my mind, Madam President, the American people remain, and always are, deeply concerned about an issue that by definition touches each and every one of us, and that is our collapsing and dysfunctional healthcare system. While it is not discussed much in the corporate media or here in the halls of Congress, we have today in the United States the most inefficient, bureaucratic, and expensive healthcare system in the world. And that's not just what I believe. That is what the American people know to be true because of their lived experience with the healthcare system. Madam President, I would hope that all members of Congress take a hard look at a poll that was published yesterday by the Associated Press NORC Center for Public Affairs Research. And this is some of what the poll disclosed. At a time when I hear many of my colleagues tell us that we have the best healthcare system in the world, it turns out that according to this poll, just 12% of the American people believe that healthcare in general is handled very well or extremely well in the United States. 12%. At a time when we pay the highest prices in the world for prescription drugs, only 6% of the American people believe that prescription drug costs in the United States are being handled well or extremely well. 6%. At a time when COVID has exacerbated the crisis, only 5% of the American people believe that the mental health care system in the United States is being handled well or extremely well, 5%. And when so many older Americans have died unnecessarily in nursing homes, and when so many cannot even find the nursing home bed that they need, just 6% of Americans believe that the quality of care at nursing homes in the United States is very good or exceptional, 6%. Madam President, the American people increasingly understand, as I do, that health care is a human right, not a privilege, and that we must end the international embarrassment of the United States of America being the only major country on earth that does not guarantee health care to all of its citizens. And again, that is not just Bernie Sanders talking. That is what the overwhelming majority of the American people believe. According to yesterday's AP poll, 66% of the American people believe it is the federal government's responsibility to make sure that all Americans have health insurance coverage. 66%. Over 86% of the American people believe that it is absurd that millions of senior citizens lack dental care, hearing aids, and vision care. And they believe that Medicare should be expanded to cover these basic health care needs. This happens to be an issue I've been working on for several years. 86% of the American people believe that Medicare should cover dental care, hearing aids, and vision care. 86%. Madam President, at a time when our long-term health care system is in shambles, 81% of the American people believe that Medicare should cover the outrageous cost of long-term health care for senior citizens and people with disabilities, 81%. And Madam President, I ask unanimous consent that this AP poll be placed in the record.
Without objection.
Thank you. Madam President, it is hard for me to imagine how anyone could defend a health care system in which over 70 million people today are either uninsured or underinsured. As we speak, this moment, there are millions of Americans who would like to go to a doctor, who need to go to a doctor, but cannot afford to go to a doctor because of the outrageous cost of medical care in this country. Frankly, I am tired of talking to physicians who tell me about the patients who died because they were uninsured or underinsured, and who walked into the doctor's office when it was too late. Time and time again, I hear from doctors who tell me about a patient who walked in and they said to the patient, "Why didn't you come in when you first noticed your symptoms?" And the patient responded, "I don't have the money, I can't afford the copayment, or I have no insurance at all." And Madam President, we are talking about, and I know we don't talk about it much, but maybe we should, we're talking about some 68,000 Americans who die every single year because they are uninsured or underinsured and don't get the medical care that they need. This is the United States, the wealthiest country in the history of the world. 68,000 Americans should not die every year unnecessarily. Madam President, I am tired of seeing working-class families and small businesses pay far more for health care than they can afford, which results with more than 500,000 Americans every year declaring bankruptcy because of medically related expenses. 500,000 Americans declare bankruptcy because of outrageous health care bills they simply cannot afford to pay. Families in America should not be driven into financial ruin because someone in that family became seriously ill. Sickness should not be a cause of financial ruin. Madam President, I am tired of hearing from Americans who lost loved ones because they could not afford the unbelievably high cost of prescription drugs. And I'm tired of hearing from constituents who are forced to cut their pills in half due to the cost. Today, unbelievably, almost 1 out of 4 patients cannot afford the prescription drugs that doctors prescribe. And when you want to talk about an irrational and dysfunctional health care system, think about a system in which people go to a doctor, they get diagnosed as to their health care problem, they get a prescription drug prescribed to them, but they can't afford to buy the drug the doctor prescribes. So what ends up happening? They end up getting sicker. Maybe they end up in the emergency room at an outrageous cost. Maybe because they couldn't afford the prescription drugs in the first place, they end up in a hospital at a very high cost. Maybe they die. That is an irrational and absurd healthcare system. Madam President, I am tired of talking to people and families of people who are struggling with mental illness but cannot afford the mental health counseling they desperately need. Last year, as you know, a record-breaking 100,000 Americans died of drug overdoses. And I will tell you that in my office, and I'm sure that in every other Senate office, we get desperate calls from family members looking for affordable mental health counseling. And far too often, that care simply is not there in the community. People are struggling with husbands, wives, kids who are on the verge of doing something terrible to themselves, to others. And yet in this country, despite spending far more for health care than any other country, we don't have the capability of helping those people. Madam President, it's not there. The mental health counseling, the help that people need, is not there because in this system, geared toward the profits of the insurance companies rather than the needs of the American people, we don't have enough psychologists, counselors, or social workers. Unbelievably, despite spending far more per capita on health care than any other nation, we don't even have enough doctors. We're facing a major doctor shortage in America now, which will only get worse in years to come if we don't address it. We don't have enough nurses. We don't have enough dentists. We don't have enough medical providers in general. We have, however, more than enough people who bill us and more than enough debt collectors who hound us to pay for a bill we cannot afford, but we just don't have enough people to provide the health care that we desperately need. And by the way, that crisis of lack of health care providers is only going to get worse as our society continues to age. Madam President, at a time of declining life expectancy, in the wealthiest country on earth, your health and your longevity should not be dependent on the amount of money you have. It is an absolute outrage and grossly un-American that the number of years we live in this country is dependent upon our income. Studies have shown that the top 1% of Americans live 15 years longer than the poorest people in our society. It's not only the very top as opposed to the very bottom. It's wealthy people in general versus working class people. If you got the money, you're going to live longer in this country than if you do not have the money. In my view, health care is a human right that all Americans, regardless of income, are entitled to. And all Americans deserve the best quality health care that our country can provide. Further, as chairman of the Senate Budget Committee, it is not acceptable to me that we end up spending over twice as much as virtually any other major country on earth per capita, twice as much per capita, while our life expectancy and other healthcare outcomes lag behind most other countries. And this is really quite an amazing thing. We spend more, and yet our results are worse than other countries. Unbelievably, according to the Center for Medicare and Medicaid Services, we are now spending $12,535 per capita on health care. Imagine that. Over $12,000 for every man, woman, and child in this country. This is, frankly, an outrageous and unsustainable sum of money. In comparison, the United Kingdom spends just $5,300, France spends $5,400, Canada $5,900, Germany $7,300. We spend over $12,000 per year. The question that everyone should be asking is, how does it happen that we spend so much money for health care, but we get so little in return? And Madam President, let's be clear. The current debate over health care in the United States really has nothing to do with health care. Frankly, it is hard to defend this dysfunctional system. The health care debate has everything to do with the unquestionable greed of the healthcare industry and their desire to maintain a system which fails the average American, but which makes the industry huge profits every single year. While ordinary Americans struggle to pay for health care during this pandemic, the 6 largest health insurance companies in our country made over $60 billion in profits last year, led by United Health Group, which made $24 billion in 2021. Madam President, while millions of Americans cannot afford soaring health care costs, the top executives in the insurance industry receive huge amounts of compensation. In 2020, remember, 70 million uninsured and underinsured, 68,000 dying every year because they don't get to a doctor on time. But in 2020, the CEOs of 178 major healthcare companies collectively made $3.2 billion in total compensation, up 31% from the previous year, all in the midst of the pandemic. People dying every single day, cost of health care soaring, and yet the CEOs saw a 31% increase in their compensation.
So there you have it, you guys. That was Senator Bernie Sanders discussing everything. Like I said, that was about a 16-minute long session in the Senate where he discusses how we need new medical aid for people around the nation and some of the things that he's proposing. Now, we will see what comes up. I will keep you guys up to date here on the channel on everything. And also, in my next video, we're going to be doing some more updates on stimulus checks. We're getting word of new ones that are hitting and proposed. I'll let you know about it, but Liam just reminded me we've got to head out to go out to church. So when we get back, I'll see if I've got some time I can do some more updates for you, or you'll see the next video on Monday. But we got to get going, huh, buddy?
Yep.
We're going to get out to church.
Bye.
Bye. We'll see you guys later. Don't forget, smash the like button, hit the subscribe button. Oh, Smash the like button, hit the subscribe button, hit me up on Instagram at SteveRam3. Take a look at the second channel. There's going to be more content coming out to help you with growing wealth, personal finance, and Relief Roadmap. Temporarily going to be locking it in for those that have accounts. If you don't have an account, you'll be added to the wait list temporarily while we just get everybody situated for those that are having some small account issues. And Liam got a new watch, you guys.
Yeah, you saw it in the other video.
Yes, saw it in the other video, and he is still excited about that watch.
And today, when I just wake up, I just played with it.
Yes, he woke up and he was playing with it. He loved it. So, with that being said, you guys, thank you so much for joining us. We'll catch you in the next one. Take care. God bless. This is Steve.